Withholding food can present several challenges. It might be perceived as reducing the well-being of the dog, create logistical difficulties for both pet owners and veterinarians, and in acutely ill hospitalized dogs, it can delay the resumption of feeding, which is often beneficial. Interestingly, studies in humans have found no clinically significant differences in serum cobalamin levels with varying fasting times, and folate concentrations don't significantly increase after eating. Similarly, research in healthy dogs suggested that withholding food had no clinically relevant impact on the serum concentrations of these four analytes. However, a crucial gap in our knowledge remained. How does feeding affect these measurements in dogs that are already showing signs of chronic gastrointestinal disease, the very population in which these tests are most frequently used? Therefore, the primary goal of this study was to determine if the serum concentrations of cobalamin, folate, CPLI, and CTLI obtained 2, 4, and 8 hours after a meal would be comparable to the values obtained after a 12-hour fast in dogs with ongoing gastrointestinal issues. A secondary objective was to assess whether any observed changes due to feeding would alter the clinical interpretation of these test results. The study's results suggest that while for cobalamin and CTLI, measurements taken 2 and 4 hours after feeding are on average statistically equivalent to fasted values, and folate is equivalent at 2 hours, a substantial number of individual dogs experience changes in the clinical interpretation of these analytes after eating. This was particularly true for cobalamin and folate. The observation that postprandial cobalamin concentrations were generally lower than fasted values in this study, unlike findings with high-dose oral supplementation, likely reflects the physiological doses of cobalamin present in regular dog food. The fluctuations seen in cobalamin and folate levels after feeding could be due to various factors, including subtle differences in how these vitamins are processed by the body, normal variations in the assays themselves, or potentially altered nutrient absorption related to delayed stomach emptying in dogs with gastrointestinal disease. Stress from being in a hospital setting could also contribute to delayed gastric emptying. Interestingly, studies in humans have shown that cobalamin and its binding proteins can vary within a 24-hour period, seemingly independent of meals.